everyone understands that quality is important no matter what profession you are, right? And particularly in medicine. And in the past, we always just assumed that we knew what that meant, but now I think we actually have definitions for what that means, and you not only have the definitions, but you also have the tools in order to enact that. And the gratification that comes from that, both from the family and from the patient, cannot be described.
2 years ago at Lucille Packard Children's Hospital, we began making some lasting changes in the way we work. Since then, we have dramatically improved care delivery, patient and family satisfaction, employee engagement, and overall efficiency. All of this has been the result of a new way of working, a new way of thinking that we are now adopting hospital-wide under the oversight of Dr. Craig Albanese, our new Vice President of Quality and Performance Improvement. We call this approach the Packard Quality Management System.
One of the primary components of the PQMS system is daily management, and that's a system that brings clarity and efficiency to processes that are often very chaotic and disruptive. And the way that we do this in here in perioperative services is with our daily Gemba rounds.
Hi guys. How are you? Hi, how are you? 60 were late.
Okay, were they cath lab or surgery patients? We stop in every department that's part of perioperative services and touch base with the staff every day, so we hear what their current issues are.
Something that came up yesterday that we should think about is that the turnaround time for our XRTs back to back to back, there was some concern whether the 20 minutes was feasible.
We use that time to address problems, either quick hit problems or problems that are longer term that we then put on our issue board and deal with over a longer period of time.
Wendy was going to follow up with Lorelei and Lori about the glucometer testing.
We're great at doing performance improvement projects. No one is great about sustaining them. And the way we do PQMS now in the daily management, it makes us able to sustain the improvements we make. We've made some real strides in patient satisfaction. We've decreased our time in system. We have the patients come in 15 minutes later than they used to come in.
Thank you.
Thank you.
Thank you.
It is a sustainable management system that makes problems and improvements a visible and active part of daily work and culture. While the healthcare industry used to work hard to hide its flaws, PQMS helps us cultivate an environment in which problems are treasured, quite literally as opportunities.
We're already using principles of PQMS on a daily basis, from our value streams through our visibility walls. We've mapped out our patient encounters and the time that they're in the system with us, from the time they arrive all the way through the time that they're discharged. So as we level load, then the PACU won't get slammed. And so a part of capturing how are we doing, we each chose a metric to follow, and we wanted it to be really simple. We wanted whoever was going by to take a look that they could really easily read whether we were going to hit target or not. And so I think that that is one of the really great benefits of PQMS, is that it really allows the staff to see how their work on a daily basis can impact those higher level goals.
The second room that went in late was at 7:35.
Okay.
The specific reason they gave me there was it was a change of shift in the NICU. I just took it upon myself a little bit to get a better understanding of what's going on.
Every employee is empowered as a problem solver and a problem preventer. Every level of leadership is focused on providing support and coaching as their primary role. And most importantly, the clinical outcomes and satisfaction of our patients and families are our primary measure of success.
I'll take the next step on those monitor remotes. Put me down for that.
I could think it would be a really good opportunity to figure out, how do we process? How do we move things forward? How do we consistently keep our equipment here?
I submitted that on Thursday. We discussed it at CEO staff, so I'll give an update.
Now problems are not bypassed. We find them, we identify them, and we solve them, and we move on, and we never have to deal with that again, so new problems can be solved, all the while moving towards a better, more efficient operating place to work.
And here in the Johnson Center, we've started PQMS about 3 or 4 months ago. We've been getting better supplies through the supply chain. We've been getting more help with the NNPs. We've been getting help with the physicians, and it's helped our teamwork too. It gives us all a common goal, We know what everybody's starting to do. There's a part of that called standard work. So we know the nurse practitioners are doing this, the physicians are doing this, the nurses are doing this, the USAs are doing this, and that's how we identify how we all contribute.
The environment we work in, we want to be fairly standardized. I want to know where to get a piece of equipment. If I need to put in a chest tube, I need to know where those chest tubes are. It can't be changing from day to day. If I am ordering something from labs or from radiology, I need to know how to get that order done, and a PQMS helps me execute my orders. How's he doing?
He's good.
One of the processes that occurs here pretty much every day is writing intravenous or IV nutrition for all these tiny babies that can't eat enough by mouth. And the medical staff has to write this early enough to get to the pharmacy, for pharmacy to make it up, and for it to be sent back to the bedside nurse to be hung before the last bottle runs out. And the bedside nurses have already told me that they have noticed that this TPN solution is getting to them sooner and more consistently than ever before.
I come to work and I get to learn something new every day, whether it's using Gemba rounds as an opportunity to learn more about the operating room, or it's helping develop my staff, or it's touching the life of a patient. All of that's really exciting for me, and so this journey has been really rewarding.
We're all marching in line towards the same thing, but also lets me feel like it's not just some impersonal role that I'm playing, but yet people are listening and care about what I do and how I think it can be done better, and you have a voice.
I got into healthcare because I love kids. This gives us a light and a goal that we can work toward for our patients. So we can say at the end of the day, indeed we did, instead of we think we did a good job.
PQMS should make all of our jobs better, and it'll be better for patients from day to day, the babies from day to day, and the families should be able to tell the difference by getting healthier babies home sooner. It's my job. It's what I live for.